That people don't really want a diagnosis. There was still that myth. And it was, so we made a point of asking everybody we interviewed that had a diagnosis if they wanted a diagnosis. And they said, we don't want dementia. But if you know we've got it, it's ours, it's not yours, and we have to take that. Even if it's the worst day in my life, I need to know so I can put things in place. And that was a real eye-opener, because even, and I'm talking about primary care professionals who are quite outspoken in the world of dementia and understand the symptoms, but there is still that question. And the other thing is, and then what do you do? And most people, we said, okay, there's all this, creative, social, dementia adventures, everything, there's lots of things to do. And time again, it came back to, yes, I have 7 minutes. I don't know any of that stuff, so how can I access it? So there are little things there, I think, that we can really address quite easily.
And I think we were talking about that at lunchtime, just saying that from the time you get that diagnosis, you may actually not need very early on a lot of one-to-one or a lot of support, but what you need is someone that you know you can go to that's going to give you that. And that person needs to be able to interact seamlessly between all the services in primary and secondary care. So one person, one key person, sorts that out for that person, for that family. And I think often that's where it all becomes very disjointed. And just thinking about where we work, we have 3 community trusts that we serve who all operate differently to some extent in terms of timing for referrals, etc. And that causes huge problems.
Do you think that person should be able to look after their total health and social care needs?
Yeah, I do.
Yeah.
Well, I think they should be the link that helps them from then on.
But isn't that a really direct question for this group? Because in Scotland, for example, they've just announced that when somebody gets a diagnosis of dementia, they get a named support worker for a year. Now, you'd have all sorts of... Sorry, Sally.
I was just saying, a year.
A year.
Yeah.
So you'd have
I
all
think it
sorts
needs
of
to be
questions
for their
around
journey,
why it's for a year. But I can understand that, and in terms of whether you encourage someone to have a diagnosis or not, my first question is what support do you get following a diagnosis? And I think that the time you need intensive support is actually when you get diagnosed. And I've been working directly with people with dementia. We've been doing some new Who's Shoes material, and I've got a guy who's actually said, as one of our recorded messages, when I got diagnosed, the consultant asked me, have you got any questions? He said, I couldn't think. He said the next day I got a million questions and I got nobody to ask.
It's so often, people are left, I had one family say to me, it was the longest walk I had to my car ever after I'd had that diagnosis. And I think it's so important to have somebody that you can talk to, that you can dip into, because it's a long journey, isn't it? You can go for quite a long time, quite happily, and then you'll have a period of transition where things will become more complex. And it's so important for both the person with dementia and their carer to have somebody that they can talk to and trust, who can go on that whole journey.
I think the group that we must never lose sight of is the people who haven't got that family support, and particularly people with more advanced needs. And if our system's good enough for that person, it'll be good enough for everybody.